Hello, I am Chelsea Brackle. I am a nursing student at Indiana State University in the LPN to BSN program. Today I want to talk to you about diabetes education. The population at risk is type 2 diabetic patients, ages 45 to 60, due to lack of knowledge and support pertaining to healthy lifestyle and diet. The topics we will cover are healthy diet, exercise, medication administration, staying healthy, and sick day rules. These will also be listed on the agenda, which has been attached. The purpose of this presentation is to educate patients while supporting them through their diabetes diagnosis. The goal is to live a longer and healthier life. At this time, I will ask you to please take the pretest, which has also been attached. The learning objectives for this presentation are: the patient will be able to demonstrate healthy meal planning and explain the importance of healthy nutrition by the end of the presentation. The patient will show improvement and reduction in weight and BMI within a period of 3 months. The patient will demonstrate proper exercise routine and display positive benefits in blood glucose control within a 6-month period. The patient will be able to display proper medication administration by the end of the presentation, and the patient will have an understanding of how to properly plan for sick days and demonstrate how to apply sick day rules by the end of the presentation. Maintaining a healthy diet is a great approach and management technique for type 2 diabetes. There are a variety of meal plans available for diabetic patients. Some of these are Mediterranean-style diets, low carbohydrate, vegetarian or vegan, low fat, or DASH. Every patient is different, so a certain healthy eating style may work better for some than others. According to the article, Changes in Overall Diet Quality and Subsequent Type 2 Diabetes Risk, 3 U.S. prospective cohorts, Mediterranean-style diets have been associated with a lower incidence of type 2 diabetes. The Mediterranean diet focuses on plant-based and locally grown foods such as fruits, vegetables, grains, beans, and nuts, with limited amounts of dairy, red meat, and wine. The DASH diet you may have heard of. It is used in patients with high blood pressure. The goal of this diet is to decrease sodium intake while increasing the intake of fruits, vegetables, whole grains, and low-fat dairy options. Culture can also play a vital role in diet. Each culture has their own foods that they like to consume. It can be especially difficult when eating outside of the home. Some find it beneficial to prepare ahead of time and view the menu before going out to eat. This will allow you to plan your meal ahead of time, make the correct food choices, and know what calories and food options you will be taking in. Meal planning and portion control can be difficult. The American Diabetic Association has a great tool for creating your own plate. This allows you to see the different options available and how much you should consume of each area. They recommend on a 9-inch plate, 50% should be non-starchy vegetables such as broccoli, spinach, carrots, and cauliflower. They recommend consuming at least 3 to 5 servings a day of non-starchy vegetables. 25% of your plate should consist of protein. Some options are chicken, fish, pork, cheese, nuts, and seeds. 25% should be grains or starchy food such as corn, sweet potato, potatoes, rice, or pasta. They also recommend 1 serving of fruit with your meal and a glass of water. If you are looking for other options, the American Diabetes Association has great recipes for healthy meals and snack alternatives. They recommend preparing ahead if you know you are going somewhere where you might become hungry. This will allow you to pack healthy alternatives and avoid going to the vending machines and consuming starchy or sugary foods. Exercise is another great approach to diabetes management. The American Diabetes Association recommends 150 minutes of moderate to vigorous exercise on a weekly basis. They suggest breaking this up at least 5 days a week in 30-minute increments. It is important to find a hobby you enjoy. Some examples of aerobic exercise are bicycling, brisk walking, dancing, swimming, and hiking. It is important to set fitness and weight goals. Find a partner and work with one another. This can be beneficial to hold each other accountable. You can also do household chores throughout the day. These are great activities to get the body moving. Type 2 diabetic patients may be prescribed an oral medication. Some may also require insulin injections. This may come in syringes or the insulin pens. It is important to know how to administer insulin for the best results, such as rotating injection sites. You will need to administer in fatty areas such as the upper arms, thigh, and abdomen. It has been found the fastest area of absorption is the abdomen. Insulin will need to be administered 30 minutes before a meal. Staying healthy is an important aspect of diabetes management. A1C should be monitored every 3 to 6 months, and glucose monitoring should be done at least daily and kept in a written log. When visiting a primary healthcare provider, it is a good idea to take the log of glucose readings with you. Annual eye and dental exams are important due to the effects of diabetes. Being proactive can help prevent infections from occurring. It is recommended to get a flu shot annually. A complete foot exam is accomplished yearly due to the decreased sensation and circulation in the feet. This is to help monitor and prevent sores or infections from occurring. Preparing for sick days is important. You should have phone numbers available for your primary healthcare provider, diabetes educator, and dietitian. You need to continue taking diabetes medication as prescribed while staying hydrated and trying to take in your normal daily calorie count. You can prepare for sick days by stocking up on water, diet soda, broth, Jell-O, and other food items that can be tolerated while sick. You can secure these items in a box so they will be available when you would become ill. It is also important to know when to call your doctor. If you have had vomiting or diarrhea for over 6 hours, or a fever for more than 48 hours and still not feeling any better. Thank you for joining me today. I will now ask you to please take the post test that has been attached. On this slide, you will find references and great resources to continue your diabetes education.